So, for all of those joining us, welcome to the Teaching Mindfulness Summit. I have the great joy of sitting with Dr. David Treleaven today in conversation. I look forward to hearing his thoughts on various topics, and many in the mindfulness community know him well. And um, for those who don't, let me give a brief introduction, and then I really want to spend most of the time listening to David. I'll ask a few questions, but I want to open and hold space for him to share his thoughts on things. So David is a writer, educator, and trauma professional working at the intersection of mindfulness and trauma. He's the author of the acclaimed book, Trauma Sensitive Mindfulness, and founder of the Trauma Sensitive Mindfulness, or TSM community, a group of practitioners committed to setting a standard of care through mindfulness-based practices, interventions, and programs. David focuses on offering mindfulness providers with the knowledge and tools they require to meet the needs of those struggling with trauma. His work has been adopted into multiple mindfulness teacher training programs around the world, including UCLA's Mindfulness Awareness Research Center, Brown University, and the Oxford Mindfulness Center. So again, David, welcome. Thank you for being here. And so as we think about this idea of a teaching mindfulness summit, I wonder if you could walk us through a little bit about your pathway to teaching mindfulness and what led you to this space and practice of mindfulness.
Sure. Yeah. Thanks, Vamsi. It's great to be with you. And I mean, I'm happy to talk and also happy to be in conversation given your background. And so I'm looking forward to this.
Yeah.
I originally from Canada. I trained as a clinician in Vancouver, BC. And my primary work was working with men who were actually sex offenders.
Mm.
And I had done individual and group work with BC Forensic Services, and so that was my inroad into trauma. Actually, was working with people who had caused harm, and it just opened up many different doors. And one of the things that I found during that work, which was quite heavy and intense, was I needed to be in my own seat as a clinician, and I'd meditated on and off, but really leaned into my practice at that point, and I found it extremely helpful working as a clinician around trauma.
Mm.
And then that work just opened up a lot of inquiries for me about like, what's the relationship between meditation and trauma and mindfulness? And I ended up having my own challenging experiences inside of practice, which some people will know, but I've written about it, that I was doing longer term retreats, and I found that um, I was focusing on some of I was having some flashbacks basically from the work that I had done in BC. It was causing a lot of dysregulation in practice. And the basic instruction was, just keep coming back to the cushion.
Mhm.
And something wasn't working about it. And so it just opened up this whole inquiry for me. And after I talked to a number of people, they said, have you considered that you might have been experiencing some kind of secondary or tertiary trauma from all the work that you had been doing with sexual violence? And I hadn't. And and it was one of those moments where there was a limit to how deep mindfulness and meditation could go in terms of my own integration of those experiences. So anyway, that became like five or 6 years of just practice and conversation, and talking to people like you, just trying to get really curious about what are the best practices when someone who's struggling with trauma is attempting to meditate. That
Mm.
was really the opening, the main question, and it's remained the main question for me for about 15 years.
Mm.
So that's what I'm up to, is really teaching people like, well, okay, if we assume trauma's there, what are the best practices that we'd need to know in order to make sure that people are practicing a safe and effective way?
Yeah. Yeah. Amazing, right? That I've always appreciated your vulnerability first in sharing that sense of not creating any distinction or distinguishing myself from those that are survivors of trauma, that there's a sense of, yeah, the experience of flashbacks within your own practice, stemming from secondary trauma, which I'd love to hear your thoughts about and definition of, because I feel like one of the challenges sometimes in our field is that a lot of words are used and various definitions are applied to them. So people will wonder, like, well, what is the definition of trauma? What is the definition of secondary trauma? When we think
Mhm.
about meditation, when we think about mindfulness. But I've always appreciated that wherewithal, that vulnerability that you bring to the work in sharing your own story and what's kind of guided you. Because I think a lot of times in this space of trauma, there's such a significant divisiveness. Like, well, here's certain statistics, and people will sometimes ask me, like, yeah, that makes sense. Like working with veterans who have suffered from trauma or continue to experience trauma, working with those in the forensic population, working with young adult survivors of trauma. Makes sense. We should be doing that. But what relevance does that have for me? So for newer teachers entering into this, or teachers in training, let's say, if folks were to come to them and say, like, I read about this or I heard about David's work and it sounds amazing, and like, what relevance does it have for me? What thoughts would you offer?
Such a great question. I mean, I came up, never would have associated the term trauma with my own life, and we could talk about the secondary trauma and all the field around that.
Yeah.
But what I discovered was I was working with a somatic experiencing therapist. Some listeners will know that it's a psychotherapeutic approach to trauma work. And what I discovered was that some of the basic trauma principles of treatment were proving really effective for me, even in areas of my life
Mm.
that I wouldn't necessarily consider trauma had touched. Like there were all these amazing tools around attention and self regulation. And so when I teach people, there's the entry point of talking about trauma, as you just did. And then what I find is at the end of a training with people, they say, so it seems like this work is actually relevant for most people because we're working with dysregulated nervous systems. Like fundamentally, we're working with the nervous system.
Yeah.
And so I think there's a truth in that. Having said that, I do think there's something important about drawing a line in the sand and saying there is a particular kind of stress, traumatic stress, that really involves a threat to life and limb, and that is eliciting and working with mechanisms in the mind and body that are not just, say, negative emotions. Like I thought about trauma very much as an intense negative emotion,
Yeah.
and what I realized is at some point was, oh my gosh, people who are struggling with trauma, and we can talk about that definition if you like,
Yeah.
they're going to need actually some different tools to be able to integrate trauma well. I mean, I came up as a body centered psychotherapist. So I just say, where do you feel that in your body?
Yeah.
And what I discovered is that's not always super helpful with trauma, that we actually need a whole different world, as you know.
Yeah.
So I don't know if I'm answering your question, but I think of it both very broad. And then I do want to still shore up that when we're talking about trauma, there is something important that we can train in that we need to know.
Yes, exactly. Which I want to open some space for to hear when we think about your work. Oftentimes, of course, like I find it to be a seminal work, trauma sensitive mindfulness. I think it's now used in so many programs. I think it should be really required reading, required consideration for mindfulness teachers. So when we think about this word trauma, I think it's oftentimes, it's a struggle. It feels like currently. I was listening to a psychologist on a podcast once, and he was asked, do you feel like the word trauma is being kind of bandied about a little too
Oh, totally, totally.
haphazardly now, like willingly
Yeah.
a little bit, right? And he said something, I'll misquote him, he's a lovely psychologist, but he's like, he reflected. It wasn't this kind of knee jerk, like, yes, definitely. And sometimes I'll have that. I'm like, yeah, I think it is, but he said, maybe, yeah, maybe it is. And I always want to be cautious, I suppose, of like minimizing anybody's pain. And that's where I appreciate what you're saying. Like, what definitions we use for trauma, I think, are important and carry relevance. And
Yes.
think about the application, like you're saying, to a dysregulated nervous system that at more severe ends.
Yes.
If we continue to bring a lens of like not trying to minimize anyone's pain, maybe in some ways it's not to say that it's okay or not okay to use this word, but at the same time, if we keep this broader lens, like what pain are you carrying? And might
Yes.
there be modifications to, be it meditation and mindfulness practice or other things that need to be personalized and precisely perhaps offered to you in an individual setting?
Yes.
Type of lens
Yes.
that I think you speak to. So could you offer a little bit to the groups, like your thoughts, like, because it seems to be there's so many definitions of trauma that are
Oh my gosh.
curled
Yeah.
about it. What
You and I could talk for many,
exactly?
many
Just
hours, I'm sure,
exactly.
about this. And okay,
What
so
stands for
yeah, go
this?
ahead.
Yeah, I was just wondering, like, from a, if you were as I think about you're thinking about, if we were to offer a definition of trauma, though we acknowledge there are many, uh,
Yes,
what's landing for you these days? How are you thinking about that? How are you sort of responding to that as people come like, what are we even talking about when we use this word?
absolutely. I tend to true closely to the Diagnostic Statistical Manual definition. So, exposure to one of three things: actual or threatened death, serious injury, or threat to physical integrity, including sexual violation. I tend, and I had a mentor, her name's Babette Rothschild. I don't know if you know
Mm,
her, but she wrote a book, The Body Remembers, and she was a mentor for me on the book. And to own my own bias, I was really thinking about trauma very generally. And she just kept trying to shore up, I think, really this threat to life and limb, where really it's a survival based response. And, and just, I'm sure many listeners will know, but then inside of that, we can be exposed to trauma, as you know, directly, witnessing the trauma second. Third, learning that a trauma happened to someone close to
mm,
us, like a family member, close friend, or
yeah,
through repeated exposure. So this is the secondary trauma or tertiary trauma. So that's the encapsulation that I think about with trauma. But then inside of that, to your point, there are people that will live through and have incredible exposure to trauma who don't necessarily develop ongoing symptoms. And then there's other people who will be experiencing, say, intense neglect in childhood, which it's arguable that is a threat to life and limb if you're being neglected severely. So other people will have a traumatic response. So that's the definition I tend to try to create the container around. But then to your point, most of the mindfulness practitioners that I work with, their job is not to diagnose PTSD. I think it's helpful, and I'm so glad that we have professionals that can actually make that diagnosis. I think it's very important for medication, also for insurance. But to me, the most important question is, are the practices that we are offering a person or a group, is it supporting them? Which I know is tricky because then we get into the question of goals. But for someone who's traumatized, sometimes meditation will exacerbate symptoms of trauma. And in that case, more will not be better
yeah,
in terms of meditation. So my work is to train people to know where are the dividing lines between when should you lean in, because I'm not saying it's about being comfortable, and then where should you refer on if you're not a trauma professional yourself. So it's both. I'm curious for you what you think. I think of it specific and broad at the same time. What do you think?
yeah. I agree from that perspective of trying to create some framework around, as you said, severe compromised, a, a state of having our safety severely compromised at its
Yeah.
core, as you said, significant danger, something that leaves us feeling, I think, profoundly unsafe. So
Mhm.
thinking about really the effects of the event, that um, trauma isn't situated or nested exclusively in the event that occurred or the events. Really, the experience for that individual, which could be highly individualized if it was some type of group traumatic event, an earthquake or 9/11, people will have very different individualized experiences based on their social support, where they were, and then those enduring effects that continue to affect mental, psychological, spiritual, overall well being. Um, so I do think it has sort of some broad parameter, yet at the same time, that sense of your safety was compromised. There was a feeling of severe danger that's leaving these enduring effects on your psyche, and overall well being is compromised, such that care may be indicated, or a deepening connection with your social support system, sort of having that sense of stability and safety in relationships. Um, so when we think about this definition related to the compromise of your safety,
Mhm.
enduring effects on your well-being in various dimensions, how do we then bring that? How do we synergize in a way, as you would call it, like trauma-sensitive mindfulness? Like
Mhm.
if somebody was like, okay, so I understand, I think what we're talking about with trauma now a little bit, think I understand what mindfulness and meditation are.
Mhm.
What's the synergy between them? Like how do you define that? How do you like how would you explain that?
It's great. So great to talk to you about this. Uh, okay. I think of it in two ways. I'll try to keep this somewhat brief. On the one hand, would be a commitment to not doing further harm to people. Which when I think of trauma sensitivity or trauma informed practice, that's one of the commitments that I think people make. And my work was really centered, especially at the beginning, around what are the particular ways that a mindfulness practice can actually exacerbate trauma symptoms. And and just to be clear, in no way am I saying that meditation is dangerous or we should all be afraid. I really don't come at it that way. It's just good to know that there are times when more is not going to be better in terms of an intensive practice or asking someone to attend internally. So I'd say half of my work is to really just raise consciousness and awareness. If there was one thing I'd want people to take away from this interview, it would be this idea that, okay, like it's good to know that mindfulness and trauma has a complicated relationship. It's just
Mhm.
just that awareness I think is huge. But then second, and this gets really into the deep end and I think is really interesting, I think that mindfulness is a profound competence in terms of healing trauma. And I am a big fight for, and I'm curious your take on this. I really want people who are struggling with trauma to have access to practices that would help them grow this capacity for mindfulness or dual awareness. Let me just give you a quick metaphor that
Yeah,
I think of with this. Babette Rothschild talks about trauma fundamentally as stuckness. She
mm,
actually has this image of a soda bottle shaken up and it's supercharged. And if you open it up all at once, it's just going to flood. Like literally, that can happen. We become flooded. And
yes.
Babette says the way to work with this is to actually allow there to be a slow release of the carbonation, the gas, kind of like
Mhm.
shh. And it's a very delicate, nuanced process to do that. But when I'm working with someone who has mindfulness as a skill, it is so profound to me. Someone can be feeling terror, some of the things that you named. It's a fundamental impact on a sense of safety, and they can feel threat, terror, huge emotion or sensations, and yet maintain a degree of presence and
Mm,
allow it to happen. Like a client who goes, "This is so scary, but I can stay online here." So this is where I think mindfulness is a huge benefit, especially in one-to-one therapy. So I think that there's two things. One, the more kind of the basics, and then we can go a lot of different places in talking about how mindfulness can help people really integrate and heal trauma. What do
yeah.
you
Well, I
think?
want to I want to open up some space for you to speak about that exact idea, right? Like how can mindfulness be offered? One story I'll often share. I'll just tell it briefly here because I hope it just sort of segues into
Yeah, yeah.
for you to speak about sort of how might we respond. I was working with a patient many years ago. We'll call her Emily for today. And many listeners will know about the ACE study or the Adverse Childhood Experiences study. And she had an ACE score of 9, like significant abuse, neglect,
Hmm.
significant dysfunction within her household. And we got to know each other and over twists and turns. Like I was studying mindfulness, and a lot of my practice was oriented to breath oriented mindfulness at that time, sort of earlier in my trajectory and training and my own experience. But I found it very, very useful, found it profoundly sort of grounding for me. Like found like it was helping me to relate to myself more effectively. So as we got to know each other more over time, like many months of slowly getting to know one another, I introduced this to her. I said, like, would you be open to giving it a try? I think it could be helpful. I found it helpful. And so I introduced a mindfulness of the breath practice, which, as you know, obviously we're just attending to our breath and not trying to change it or breathe in any special way. We do a practice for maybe 2 to 3 minutes, kind of a brief practice just to get a feel of it. And her eyes happen to be closed and she's opening them. And I'm sort of sitting and I'm like, what'd you think? And she leans and she's like, I don't think I'm into this breathing shit, Momsy.
Nice.
But
That's honest.
one of my best teachers, because we had engaged in more like playful things like passing a ball back and forth, literally in the clinical way, throwing a football back and forth. And what I think Emily helped me to see was that there are many, many doorways into this room of awareness. For us, it was more of this relational, playful kind of practice that let our bodies be a bit more synchronized to help us feel that sense of safety and stability in our relationship. But she kind of opened my eyes like, huh, like if this isn't the way, but rather a way, huh, Like, how do we need to begin thinking about what are other ways, what are other opportunities, invitations, maybe on ramps, different
Mhm.
approaches that might make this feel more inviting for people, as you said, to assist with over time getting unstuck, if you will, to help with regulation. So when you think about that, like various ways or various practices that you might offer to different individuals or groups, what are some of the things that you feel like come to mind that help people to feel like they have choice and space, so they might feel like there are many doorways into this room, if you will, of awareness, into this room of regulation?
That's great. This is where I think the rubber really hits the road about like, okay, so what are we talking about? How would this look different if I was to be a trauma sensitive practitioner in
Yeah.
mindfulness? And so I love that. I love that example. And I think there is an inherent creativity for trauma informed people to say, okay, let's just figure out quite practically like what works. Okay, maybe the breath didn't work. Let me give an example. Take one common practice and just put a lens of trauma sensitivity on it, which would be working with anchors,
Yeah.
which you will know, but for others they won't. Um, so an anchor, very common practice to stabilize our attention. We choose one place that we're um, focusing. Often the breath will be a common anchor point. So this could be in certain traditions, the sensations of the nostrils or the rising and falling of the chest or abdomen. So this is a kind of 101 way to establish some mental stability and a
Mm.
reference point to come back to when we're lost, as we inevitably will be in thought. The issue here, if you look at an anchor through the lens of trauma, the respiratory system will not always be a useful anchor. It's simply not neutral for people. So some people maybe they had could have drowned or they might just have any kind of charge. Our respiratory system intimately tied to our sympathetic nervous system, which connects to trauma.
Yeah.
So given that, what do? It's to your point, we offer some choices. So I lead a meditation where I say something like, I'm going to give you a brief practice and we're going to connect with three different anchors: the breath, sensations, and sound.
Mm.
And you can choose the one that works best for you. So we're starting off not putting, as I think to your point, the breath is not the only way.
No.
Uh, all we're doing is just offering people hopefully a choice that allows them to access the benefits of practice. Okay, one caveat here that I wonder what you think of this is I think we can go much too far with choice. Choice is a great principle of trauma informed work. And to me, there's a societal issue right now around carefulness. A lot of people kind of walking on eggshells, feeling like, well, I don't want to trigger someone. Or to me, part of the practice in a clinical role or in a group is to challenge people. And
Yeah.
so I let people know, look, this isn't about making you comfortable. I don't want you to just bop around from anchor to anchor. And if you find yourself totally overwhelmed, it's okay to shift. So
Yeah.
I'm trying to find this sweet spot all the time between
Yes.
not too tight, not too loose. Do you know what I mean? I'm curious what you think of
I
that.
I think it's brilliant what you're saying, right? Because I do think that's, as you said, kind of the needle we're often trying to thread in a
Right.
way. You're saying we want to create some sense of frame so they feel, they, whoever that is, be it the individual working with the group, ourselves, a sense of being held, a sense of safety, and
Yeah.
can we feel invited to explore boundary and edge and know that that might be useful, that bumping up against some things may not be necessarily detrimental or wholly consequential, that there may be a lot of growth and opportunity in that. And as you said, how do we know when we're overwhelmed? Where is that point where we're able to begin to feel that and explore, like approaching an edge of something, maybe taking a step back, kind of that dance or a rhythmic sort of balance with that. um, so I agree, like, I think we have to not give a sense that we're trying to foster avoidance by any means,
Yeah.
and we're here with you to practice together in some way so that there's opportunity for exploration. I think, as you said, curiosity. I loved how you said it. Yeah.
I think of that as that's level two
Mm.
in terms of a trauma sensitive adoption. I'd say level one would be something like just this awareness that trauma might not interact well with meditation practices. But I'd say level two is what you're naming. It's this ability to start to know, when do I lean in? When do I back off? When do I challenge? When do I, and that's the art of it for me. This is not a science of just, we do A, B, C, D. I think it's about a system of principles, and then we really get nuanced. The best trauma people I know are masters at being able to seem to know when to like challenge their client. And I love that. I think we can grow that competency through training.
Yeah. I wonder, as you say that, I think a lot of teachers in training and myself included, our ears are all perking up like, huh, like what what might be, not to shift towards resources necessarily, but like, can you speak more towards that? Like for teachers who are thinking like, huh, like in addition to you, for example, who might we look towards or how might we explore that a little bit more? As you said, the art of it. So we're not just creating sort of a roadmap or checklist, but it's
Hmm.
the willingness to know that this is a little more jazz, like it's art. We're trying something out, experimenting in the moment, maybe. Like, how would you guide someone that's newer to that idea who's like, but I kind of maybe I feel more comfortable in the space of a checklist or a guide.
Yeah.
Not that we abandon that, we hold
Yeah.
that, and how do we explore this art a little bit, as you said?
Absolutely. I think I tend to talk a bit like there is a checklist.
Yeah,
It's useful. We can learn all the important um, modifications that we can make, or even like waiver forms. There's so many things we can learn, of course. But then to your second point, I think there is this question of, okay, what's my embodiment as a practitioner? And my favorite thing in this conversation when I'm working with people who are coming to me for online training or whatever is we take a moment to recognize the skills they're already bringing that
mm,
actually work quite well around trauma. And one key one is the ability to attune. Just our presence has huge implications around helping someone self-regulate, becoming kind of a psychobiological regulator for someone. This I go into this in the book a little bit about
yeah,
social engagement. But so I think it's nice for people to know, anyone listening, it's like you have a whole bunch of competencies you're already bringing. And then I love your question. I mean, I here's a couple of my top ones. I think the question I would have people ask is, where are the areas that I actually feel are lacking in my own skill set that I'm interested in learning and growing and developing? For some people I know, they really want to get into more somatic work, more body-based pieces. Others, like for example, somatic experiencing that I mentioned earlier,
yeah,
it's long. I think it's a 3-year training, huge investment in becoming a trauma practitioner. But I know nurses that have done that, people who just wanted the principles, and that can really work. So, I mean, I have my I'm not plugging my course, but I have my
uh-huh,
online training, which is trying to really say, like, how do we really bring in all these pieces around? How do we cultivate belonging? How do we do a body scan? And inside of that, there's lots of different people doing great work around racial and social justice. Rick Hansen doing work around resilience and resourcing. There's so many resources inside of that we can learn, but I think of it like kind of a palette, what we need to develop.
yeah.
What do you recommend to people?
Certainly, your book is often a guide.
I'll take
Yeah,
it. Yeah.
yeah, no, I found it incredibly helpful in your course and the lectures that you offer. You mentioned Babette earlier, Babette Rothschild.
Yeah, she's great too.
Yeah, I will sometimes recommend Peter Levine's work, as you mentioned, within somatic experiencing, um, to broaden sort of just the lens, as you said, kind of maybe more level one to increase our sense of the prevalence of trauma, like the maybe how like the almost the ubiquitous quality of it, how it's sort of nested in society and its larger social implications. I'll often point to Judith Herman's work in trauma and
Yes.
resiliency,
Oh my gosh, yes.
and book Truth and Repair. And that's where I wanted to hear your thoughts on it. Like one of the things she stresses is like, how do we deeply listen to individuals? Like, what does a survivor want? We sometimes societally think that survivors want to have their perpetrator, let's say, or their abuser, if that's the case, like immediately incarcerated. The legal system, the quote unquote criminal justice system is the pathway that everybody's going to want. And Dr. Herman will so like in her brilliant way, and I won't do it any justice. We'll say like, how do we deeply listen to these individuals? Like, what are they feeling like will assist with their repair, their healing? what will assist them to continue to live in like sort of that life that they truly want. So sometimes we have this opportunity, right, in one-on-one work to ask people, like, be it like, what do you need? What will be helpful for you? We might be able to explore that directly. Tell me a little bit about from your perspective, like I've been part of trainings where like there are many, many people in the room in your trainings. And it's like, how do you think about that for somebody a little bit newer, let's say, who's leading a meditation where they don't have the opportunity to be like, okay, what might be some of your needs or your needs? Like I have the opportunity primarily to work in one-on-one spaces.
Hmm.
So I can ask a person directly, let's spend some time thinking about that and wondering
Hmm.
about it. When you don't have that opportunity, what is some of your guidance to a teacher who's like, wow, there's 30 people here,
Yeah,
want to bring this lens. I want to be thinking about these principles. I feel the importance and relevance of them. How do I bring that into this space now?
such a great question. I'll tell a story that you might have heard, but hopefully someone else hasn't.
Mm,
I was in a meditation group of about 15 people a number of years ago, and it was with a teacher who I respected who had done some training around trauma. And there was a newer it was a meditation group, and there was a newer student in the class.
mm,
And at the end of the meditation, there was a period of inquiry. Teacher said, "How'd that go?" And the newer student, to their credit, they were very honest, and they said, "I hated that."
mm.
They actually said, "The sound of your voice was just grating." It was, they really just went for it.
Yeah.
And they what they said was, yeah, very honest. And they said, I wanted to, I wanted to get out of here.
Mm,
I really wanted to run away from here. And it was a moment, the teacher, everyone got kind of quiet. And I was especially interested as someone who teaches, like, how's this going to go?
yeah.
And I was so beautiful. I'll never forget it. The teacher, they kind of took a breath, and I sat back in their chair, and they said, "That's awesome. Thank you so much for sharing.
Mm,
Great noticing. Let me ask you a question. Do you know how far away you want to go?" And it opened up this new energy in the room. Like, whoa,
yeah.
wow, what an amazing question. And the person said, "Wow, yeah, there's a hill outside of this house that we were in. I want to get up there." And the teacher said, "Do you want to go do that
Wow.
with, could you bring someone with you?" And the student was like, "Yeah, okay." And so they left, and they came back maybe, I don't know, 7, 8 minutes later, and inquiry was still happening. And they came back in, they sat down, and they looked so different.
Mm,
And teacher just invited them to share and said, "How'd that go?" And the student just goes, "Thank you so much for trusting that I knew what I needed."
mm, mm.
And what they had done is they had gone outside, and they actually ran some wind sprints up and down the hill. And the person said, "I'm ready to sit.
Mm.
I'm really ready to sit." And I share that, just, I love your question. Is I think it's about an attitude, a fundamental attitude of asking the question that you posed about what does someone or what does a group need? And to let and to trust in a very deep way the psychobiology, that there's a directionality or impulses that if we can start to be mindful of and listen to, the people know what they need. And so that's, to me, that's, if we can embody that level of curiosity and respect, things can really go in interesting directions. And I'll say one last thing.
Yeah.
You were asking about groups. The
Yeah.
group was really moved.
Yeah.
Like, a couple people welled up. They were like, "Holy cow, something just happened." So there's a way that in the one-to-one interaction, it rippled out into the group. And so that's one other thing I think we can hone in and then just let that be a teaching for a collective body.
Mm, mm. Just sitting with that. Yeah, it's a beautiful story. Thank you for sharing that. It seems to embody, as you said, so many pieces, right? Like a deep sense of care, like not being just feeling like an internalization of criticism, like, oh my God, how dare you?
Right, right.
Like, just such respect, like, wow, that's amazing that you just shared that. Wow, like that couldn't have been easy. That sense of respect, as you said, like this person was invited to really tune into themselves. What do you need? Like, what's sort
Yeah.
of active in your body? Invited to do something that maybe people thought like, I don't know how this is going to go, like a sense of trust, right? And in that invitation for that person to kind of look into their body and right to kind of feel into their own needs and assess and come up with an idea and then be really like held in a sense of space of trust to try it out. Let's see what it's like for you.
Hmm.
That sense of like the teacher inviting that person to tune into the wisdom of their body. Like when we think about a lot of mindfulness programs, in the best of ways, they really try to bring in that sense of embodiment, as you said, working with the body scan being a very common practice. And at the same time, as you know, and many people in the room will know, like it can be very scary to be in your body for many people for various reasons, including in the context of trauma. It's like a place people want to genuinely like escape. And even psychologically, let's say different levels of dissociation. I'm trying to get away from this embodied or bodily experience. So when we think about that, how do you think about how do we need to be attending to the body, working with the body? Like, is it something that we should be all the more like even not hesitant, but like, should teachers be bringing like, maybe I shouldn't go there. I don't think that's the right answer. Like, but I just wonder your thoughts. Like, how do we invite individuals to engage in practices that involve more of the body, like getting out of maybe attentionally oriented practices, but coming into the body and like, where do we need to go and how do we need to think about that, do you think?
Hmm. Hmm. I This is an overlap with mindfulness meditation, particularly Buddhist world. But you might know John Kabat-Zinn's book. Oh no, it's actually Pema Chodron. I think it's just start where you are. I think that's maybe a book title. And uh, I think this is with the body. We want to develop this curiosity and get people started. I actually think we do want to challenge people to connect with their bodies for all the reasons that you said. And I think of it as one of the mechanisms of mindfulness is actually increased body awareness. And it's a huge benefit for people. And to your point, there'll be some people where starting here will be too much.
Mhm.
And so I think it's about helping people begin to simply notice their level of embodiment.
Hmm.
And if I could just give a personal example,
Yes.
I I would dissociate often in meditation practice. I would really check out and couldn't feel, and I could sit for a long time and felt proud of that. And sometimes teachers were like, wow, you can sit for a long time. And for many years, I was really frustrated. Like I was just, come on, got to come back to the body and feel and don't go away. And it wasn't until someone who had some training around trauma sensitivity said to me um, the same question. They said, do you know how far away you go when
Hmm.
you leave during practice? Very similar to the story that I just told.
Yeah.
And that was the first time someone had oriented to my not wanting to be in the body actually as not only understandable, but they were curious about it. They weren't making it a problem. And mindfulness helped me start to realize, like, when would I go? How would I go?
Hmm.
So I do think we want to encourage that level of embodiment and a body-centered practice, and at the same time leaving a lot of room for helping people explore how distant feels safe for them and where's the edge that they want to challenge. And so just one quick story. I met a person who had dissociated for years and said, oh my gosh, all the meditation teachers I ever know say I'm a great meditator. And I didn't realize until that he'd come to a training. He goes, I've been dissociating
Hmm.
for most of my practice. And there was both a grief to that, but also some excitement. So it's a whole world. And I'm open. I mean, love to hear what you think about it.
No, I love that the examples, right? That it can almost be like in certain maybe meditation communities, maybe unrecognized, understandably so, as a teacher might have many students just like, oh, that person seems very at ease on their cushion,
Right. Yeah.
sitting for a long
Yeah.
time. And the openness, that sense of compassion that teachers or friends or clinicians or whoever it is might, to the willingness to bring in some vocabulary like connection or dissociation or things that help people to begin to check in with their body,
Yeah.
to begin to recognize how far away are they going, what might be the adaptive reasons that occurred or is occurring. it sounds like a lot of your teachers and, within your own sense of your practice, you brought a lot of self-compassion, and that compassion, like, it has been embodied by a lot of your teachers, like deep curiosity, like how far up the hill would be helpful for you to run, or what would be helpful for you to, how far from your body, like really a deep sense of trust, evoking, as you said, curiosity, encouraging and inviting safely, like a sense of approaching something as opposed to avoiding. So this space of compassion feels like it's been evoked a lot of times by teachers for you, and then that for or by you within others. And then as I think about compassion, oftentimes, like, I think about it initially and at first, when as I'm thinking about it with others, it seems like that sounds beautiful. Like, what an amazing thing. Like, absolutely, we should be thinking about compassion, practicing, let's say, loving kindness practice or other compassion based practice. Seems like that would be so resonant for survivors of trauma. And as you know, like as a trauma specialist, like that can be so hard for survivors of trauma. Like, I
Oh
want to
yeah.
run, run away from this
Oh
idea of
yeah.
compassion or self-compassion. Absolutely not. That evokes such deep shame for me. I
Yeah.
wanna run away from it. So just with that sort of like nebulous backdrop, just this that I'm offering in a way, like I just wonder your thoughts about compassion again, and compassion oriented practices tend to be ones nested in a lot of programs.
Mhm.
Beautifully so, and can be such like a beautiful offering for ourselves and others. And again, I suppose just trying to continue this wondering about, like, how might we think about it? How might you encourage us to think about it in the context with this sort of like trauma sensitive orientation?
Great. I think of it as simply one tool. And honestly, I know I'm using these examples of times that teachers were compassionate with me,
Yeah.
but that was after many years of not experiencing that. Not disparaging the teachers, but I, the examples I'm using were really exemplary to me of like, wow, this is what a great question that I had never been asked before. And to your point, I do think that self compassion, wow, tread carefully when you're working with trauma. This is another example, I think, of that second bucket. I talked about the first bucket being learning how to do no harm. The second is that we have this array of tools that we can use. Maybe it's a body scan. Maybe it's more about belonging. Maybe it's about safety. There's all these different tools. And I think of them, there's a right tool or practice for a particular moment. And self-compassion is a particular moment. I mean, yes, it'd be great if it was imbued throughout practice, but I think this is what we can train in, is that once we realize we're working with trauma in the context of meditation, then we can start getting curious in a moment to moment way. What is this person, what does this nervous system need? Is it self-compassion? Is it a body scan? What is it? Because to your point, if compassion is working directly with suffering and trauma is a form of suffering, self-compassion is going to lead people right to the heart of their trauma often.
Yeah.
And to your point again, that will often lead people to deep shame. And if you, unless you've done some training and work in how to really navigate the waters of shame and help people know that, hey, working with shame, it's a high stakes piece of work that can be amazing, but can also be just, it can lead people in a really difficult, isolated place, then we don't want to just drive towards self compassion unless we know what we're doing. So I think self compassion is one important skill. I have a whole module on it where we took a really deep dive. Like, how do you do it well? It's hard to do well. It's just mere question. Clearly, you've thought about this, and I hadn't thought much about it. I'm like, great, self compassion. That'll be good. But it just, whew, it goes really deep, really quick.
Yes. Yeah.
You got to be
Yeah.
careful. Yeah.
Yes. Exactly. I think you speak towards the idea of like being attentive to the idea of what it could evoke in terms of shame, or for some people, self-criticism, disgust, all of these very, very challenging pieces, and skillfully trying to work with it. Again, not something to avoid, but timing. Can we engage with this person so it's not too much too fast?
Yep.
Is engaged in a dialogue with them and so on. Um,
Yeah.
David, you've given us like incredibly rich set of ideas to think about, and offerings to continue this dialogue. I wish I could speak to you for an hour or two more
Yeah.
daily, to be honest. Like, it's just lovely being in conversation with you. I know I've got to begin letting you go, sadly. So I did want to just offer one last question. I just kind of
Mhm.
glancing here, so I don't keep you all night. Just as we think about, individuals who are teachers, a lot of people here will be teachers in training. Just concluding thoughts, words of guidance, sort of like offerings to them in a way, like as they,
Mhm.
you and as all of us continue. I think of all of us kind of, while we may be quote unquote teachers, we're all in training, we're all practicing. So just anything we haven't had a chance to talk about or concluding thoughts you'd like to offer.
Uh, Mine is to go forward and not be afraid.
Mm,
And sometimes people hear the work around trauma sensitivity if they're new to the topic. And I think they can get a bit frozen. I mean, I've heard this from people where they're suddenly realizing, oh my gosh, I didn't realize that meditation and trauma had this kind of tricky overlap. I don't know what I should do here. And people will freeze up a little bit. And I'm of the mind right now that we, this is so needed in a very polarized world right now is mindfulness and contemplative practices generally, and to go forward and not feel fear that someone is going to get triggered and I'm going to be in trouble.
mm,
What I often encourage teachers is that meditation and any contemplative practices is, as you know, it's a very powerful practice. It will likely reveal trauma, and that's not bad news.
right.
If someone comes to you and they start disclosing a trauma or a flashback, take it as a compliment.
Mm,
My sense of this community is it's a lot of very attuned, empathic people. And so people will naturally want to tell you secrets. And it's just like you said earlier with that story that I told. You could freeze up there and go, oh, geez, this is problematic. Or you can go, wow, thanks for trusting me. And then what we can learn to do is refer on if we're outside of our circle of competence, or we can work with it if we have some training. But we can relax around the whole thing, go forward without fear, and just know it's a powerful practice. Things are going to come up and it's totally fine. People get triggered. That's not bad news. It'll happen. You can expect it.
mm,
So that's what I'd say is just go forward, just assuming trauma's in the room and learning how to work with it. And just people being in this conversation, I think this is half of the game is just having some framework and awareness of the topic. So
yeah. Mm. David, thank you so much for your time and your ongoing teaching, your ongoing development of these ideas and practices in this larger community. I always feel sort of buoyed when I know there are teachers in the world like you. I feel very heartened, as we practice, and a lot of us practice maybe regularly by ourselves, that we get reminded that we're part of a larger community. So I'm always grateful knowing that you, as well as folks such as yourself, are part of this community. So thank you again for your time today and your wisdom you've offered to this larger community as part of this summit. And so thank you again.
thanks, Wanzi. Great to be here.
Thanks. Take care. Bye bye.
You too.